Welcome to First 5 Ventura County's Help Me Grow Developmental Screening Training Series. This series is ideal for healthcare providers, early childhood educators, and other service providers who work with young children. In this module, we will learn an overview of a common general developmental screening tool, the Ages and Stages Questionnaire. My name is Grace Montejano, and I will be with you today. On our agenda, we're going to cover and discuss when to use a general developmental screening tool, provide an overview of the Ages and Stages Questionnaire 3rd edition, introduce some basic referral resources for all after screening. Let's begin with when to screen, or when may this tool be appropriate or recommended. For medical providers such as pediatricians and family physicians, there are specific recommendations and practice parameters. In 2001, the American Academy of Pediatrics first published its policy recommendations for developmental screening. Recommendations are developmental surveillance at every well-child visit through the first 5 years of age, general developmental screening at 9, 18, and 24 or 30 months. It is also recommended that a validated standardized screening tool be used. If you are a medical provider, you're likely familiar with Bright Futures AAP recommendations for preventative pediatric healthcare and periodicity schedule, which was updated in July 2022. This lists developmental screening under its recommendations for developmental and behavior with coinciding guidance by age. This schedule can be downloaded for free at the website shown on the slide. For early childhood educators, such as preschool and other preschool programs, there are recommendations for those that are part of the Quality Counts California, known as QCC. The QCC awards quality rating to early and school-age care and education programs that meet a set of defined program standards. To be considered a high-quality program, programs should complete a developmental screening annually using a validated tool. There are no recommendations for an autism-specific screening. Now let's turn our attention to the Ages and Stages Questionnaire 3rd edition, known as the ASQ-3. The ASQ-3 is part of a series of parent-completed screening questionnaires, along with the ASQ-SE2. Developed for use with children ages 1 to 66 months, questions are written at a 4th to 6th grade reading level. Parents are given a question with a choice of responses or answers. The developers pick skills that could be observed by parents at home. This tool can identify children who are developing typically or may be at risk for a developmental delay. If you would like to obtain your own AS3 kit, please feel free to visit agesandstages.com. All sets are complete with 21 master copies of the questionnaire and scoring sheets, a CD-ROM, a printable PDF, user's guide, quick start guide. The cost is about $2.95 and it's in limited copies. Also available in English, Spanish, Arabic, Vietnamese, and Chinese. Or you can visit our local First 5 Ventura County for additional kits. Help Me Grow Ventura County developed an FAQ with basic information about the ASQ-3. Please visit our website at helpmegrowvc.org/materials for free downloads. Here's the cover page for a sample of an ASQ-3. We will go through the contents in a moment. The ASQ-3 covers 5 developmental domains, which are communication, gross motor, fine motor, problem solving, and personal social. Please keep in mind that personal social is not the same as social emotional development, but more like an adaptive self-help skill. This is why we have a separate tool, the SE. The ASQ-3 comes in a set of 21 questionnaires. The slides list the age and the months of the questionnaires. The intervals are spaced 2 months apart until 24 months, 3 months apart from 24 to 36 months, and 6 months apart for 36 to 60 months. The 9-month interval was designed for healthcare providers who do the 9-month well baby checkups. It has the same items as the 10-month questionnaire. Would recommend only using this interval in a medical healthcare setting to coordinate with the well baby check visit. Let's take a moment and look at the administration window chart. In addition to listing a specific age of each questionnaire, an administration window is also specified, which means that there is a range of time where questionnaire can be given. For example, 48 months questionnaire can be given to parents of children ages 45 months to 50 months, 30 days. Administration window has been stretched so there is always an appropriate interval to administer. If the child's score is questionable and his age is on the younger or older end of these stretched windows, this should be taken in consideration when interpreting results and making referral decisions. Now let's talk a little bit about adjusting prematurity. If the child is born 3 or more weeks early, you may need to adjust for prematurity until the age of 24 months. After 24 months, you no longer need to do an adjustment. Just so you know, ASQ developers use 39 weeks as full term. Some hospitals or screening programs also use 38 or 40 weeks. Per developers also fine if you match protocols. Adjusting for prematurity can be very difficult, but then again, it could be very easy. We are lucky that we can do it either manually or we can go to our calculators. There is a calculator online that is available for ASQ and ASQ-SE. For calculating manually, you would have to adjust the child's age by subtracting the weeks of prematurity from the date of administration. Then you must calculate that date in administration in weeks, then subtract the weeks of prematurity to get the adjusted age. But feel free to download the app. And here you have it. Here's how to get the app. You can go and find it on the Apple Store or Google Play Store. It is very simple to use and very, very convenient. You can just put the administration date, child's date of birth, and weeks of prematurity, and it will go ahead and calculate which ASQ-3 or SE would be appropriate for that child. And you can also find this at agesandstages.com. Now let's determine if we have the correct questionnaire. Let's look at the cover page. The cover page of the ASQ will help us determine if we have the correct questionnaire. How? We have to record the date the ASQ was completed, the child's date of birth, number of weeks the child's premature. Remember, this is only for questionnaires up to 24 months. The calculated age at the date of the screening or adjusted age. Once that is completed, you can compare it to the administration window or age intervals. Introducing an ASQ to a parent can be challenging. Here are some ideas on how to introduce the tool to parents. ASQ provides a quick check of your child's development. The information you share with us is confidential. Answers show your child's strengths and areas in which your child may need more help or practice. For more ideas on how to introduce the ASQ to parents, please feel free to visit agesandstages.com, where you can find this free handout. Points to remember when completing an ASQ-3. 1, we want to strive for accuracy, and in order to obtain accuracy, we need to make sure that the parent or caregiver is in a familiar, comfortable environment. Also, the child is well fed, rested, and healthy, and that the caregiver tries out all the questions before they complete them in order for them to obtain the best results. Let's take a closer look at the tool itself. Let's look at the tool. There are 5 different developmental areas. The developmental areas are communication, gross motor, fine motor, problem solving, and personal social. Each developmental area has 6 questions for a total of 30 questions for the entire tool. How do we answer? There is a yes, sometimes not yet. And what does that mean? Yes means that your child is performing the skill. Sometimes means that your child is beginning to perform the skill or does it on occasion. Not yet indicates that your child is not yet performing the skill. And there is also some questions that might be on the tool that you have to fill in a little bit more details, and that is okay. Let's look into difficulty and why and how the questions are placed in the ASQ. Just so you know, questions are in order of difficulty. The later questions means that they're more difficult for a child to perform. Note, question 5 and 6 in each section are considered average skill for the child that age. For example, in communication, we expect a typical 48-month-old to follow 3 unrelated directions and use all words in one sentence. So if the parent is marking yes, then that means the child is developing typically. The overall section includes open-ended questions, which are very important when making decisions, capturing qualitative information that may not be picked up by the qualitative items. For example, Brooks training, stuttering or stammering could be identified by an overall question. Does your child talk like other children his or her age? A child may pass the score in the communication area, but still might need services. Give parents the opportunity to give feedback and note strengths or other concerns. Responses for the overall section should always be considered when making a referral decision. Now we will discuss how to score and complete an ASQ-3. Additional information is available on this score sheet and it is available on our website. Scoring an ASQ. When you receive your ASQ, you want to review the tool and see if there's any questions that have been missed. If items are missed, that is okay. Just remember that they could have been missed due to cultural, linguistic, religious, or other reasons. It is okay. We will omit them and we will show you how to omit them at a later time. Now let's go to step 2 and how to convert each item into points. Remember, yes equals 10, sometimes equals 5, not yet equals 0. And now we're going to add up each area. Let's review the sample. As you can see, all the questions have been answered. Parent also wrote a little bit more details in some of these questions. At the end of each question, you're going to see the total score. And at the bottom of the questionnaire, you're going to see the total score for that section. Let's go ahead and review this example. This caregiver marked question 2 as yes, 10 points, question 1, 3, and 6 as sometimes 5 points, and question 4 and 5 as of not yet, 0 points. The communication area should have received a total score of 25. Like we mentioned earlier, it is easier to score if all items are marked. If we are missing an item, we must adjust the score. In order for us to get that score, we can either download the calculator at agesandstages.com or view the adjustment chart. Also remember, only up to 2 items per domain can be omitted. If we are missing more than 3 items in that domain, it cannot be scored. Step 4 is to review the overall section and the caregiver's response to the open-ended questions. This section is not scored, but the parent notes can be indicative of concerns. Ask for clarification if needed. Step 5. Let's transfer information from the domain areas to the summary sheet. Simply mark a bubble corresponding to the domain area score. In this example, the communication total was 25. So the bubble under the 25 is marked. If you had to adjust the score due to a missing item, your score may not be noted in the summary sheet. Simply mark a spot approximately where it belongs. For example, if the communication score was 22, make a mark between 20 and the 25 slot. In step 6 is to record the responses for the overall section. You are now ready to interpret the scores and make recommendations to the caregiver, which may or may not include referrals. Let's interpret the scores. You will look at each developmental domain score independently from the others. The unshaded area of the summary page indicates a typical score, which means a child is developing typically in those areas. If a score falls in the range of no formal referral or evaluation is indicated, you may provide follow-up developmental activities and tips. Rescreen as appropriate for that child's age. If a score falls in the gray area or monitoring zone, provide follow-up activities and tips that will guide parents and caregivers on how to support their child's development in that area. Rescreen within 2 months to check in if the child has made progress or is still showing in this area of concern. Please make referrals as needed after a rescreen. The dark shaded area is considered the referral zone. If the child's score falls in this zone for any developmental areas, please consider for a referral or further assessment. If a child is found not eligible for service, consider rescreening within a few months to track the process and a referral as needed. We will discuss common referrals in a moment. The last step is to review the open-ended questions and respond to caregivers' concerns. Just because a child does not score in a section that is of concern does not mean that the parent does not have a true concern and might need a referral. Once the process is complete, you can mark on the summary page to see what the follow-up actions are. There is also a place to fill in for all the caregivers' responses. Once they are completed and filled in, you can file this information. Please note that the summary page also has a section guiding you through the shaded and unshaded areas. Briefly discuss common referrals that are made after a developmental screening. We will also provide contact information for VC agencies. A quick reminder about the process for early identification for developmental delays. Start with a developmental screening that indicates a risk for a developmental delay. A referral is made to an agency that can either provide assessment for intervention or special education services, or an agency that can act as a gateway to a service. If an assessment identifies delays or disability, the child may be found eligible for specialized services to support their development. For developmental concerns, these are the agencies you should be reaching out to in Ventura County. For developmental under the age of 3, we're going to contact Early Start. For developmental over the age of 3, we're going to contact Tri-Counties Regional Center. Developmental over the age of 3, you can contact special education at your local school district or the Ventura County Office of Education. All ages, you can contact your health insurance, private and/or Medi-Cal. The Early Start program is the primary resource for developmental services for children under the age of 3. They may provide developmental evaluations, service coordination, therapy and intervention services such as early intervention, speech and language, occupational and physical therapies. No cost for the developmental evaluations, but depending on the income or insurance coverage, there may be a cost for other services. To be eligible for these services, a child must be developmentally delayed, infants born with established risk conditions, infant and toddlers with high-risk conditions, infants born to a person with developmental disabilities. Tri-Counties Regional Center does provide services for ages 3 to adulthood. These services may be available and will provide diagnostic evaluation, service coordination, and services such as social skills, behavioral intervention, and respite. There is no cost for evaluation, but depending on income or insurance coverage, there may be a cost for other services. To be eligible for these services, there must be a medical diagnosis. This diagnosis must be presented before the age of 18 and be substantially handicapped to everyday life. These include intellectual disabilities, seizure disorders, autism spectrum disorder, cerebral palsy, and conditions related to intellectual disabilities. Here's how to connect to Tri-Counties Regional Center. They have 2 offices, one in Oxnard and one in Simi Valley. The Oxnard office covers Oxnard, Port Hueneme, Ventura, Ojai, and Camarillo. Their number is 805-485-3177. Simi Valley office covers Simi Valley, Thousand Oaks, Newberry Park, Westlake Village, Moore Park, Fillmore, and Santa Paula. Their phone number is 805-522-8030. You can also contact either main number and ask for the intake coordinator for anybody over the age of 3 or Early Start on-duty coordinator for Early Start. Special education services are available for children 3 to the age of 21. These services are provided through the Regional Center at no cost, which also assists with educational assessment, case management, educationally based services such as speech and language therapy, occupational therapy, and resource for services. Also, these categories are outlined in the Individual with Disabilities Education Act, Part B. To connect caregivers to the special ed department, parents must contact their local school district and ask for the special ed department. Once that is established, the special ed department will ask for a letter in writing to start the district timeline to assess the child. You can also check out the website below to identify which school your child will pertain to, or also you can reach BC SELPA at 805-437-1560. Thank you for completing this training. If you would need additional support, such as assistance with care coordination or assistance with referrals, please consider contacting Help Me Grow. If you would also need any documents that were in this training, please visit our website at helpmegrowvc.org.